Good afternoon, everyone. It's a real pleasure to be asked to speak to you today. So I'm going to just talk very briefly about enhancing student mental health, looking at it from an evidence perspective, and then looking at some very practical examples. So just to start, in terms of what we mean by enhancing student mental health, we know that it's concerned with strengthening the protective factors for good mental health, and that the aim here is around increasing the well-being and resilience of our student population. When we talk about enhancing student mental health, it generally operates at three core levels. Firstly, we've heard a lot about strengthening individuals in terms of their core social and emotional skills. Secondly, in terms of strengthening communities in which students live, work and play. And thirdly, around reducing structural barriers to mental health at a broader societal level. Looking at the evidence base and I suppose the rationale, there's good evidence that mental well-being is associated with better physical and mental health, with positive interpersonal relationships and socially healthier societies. We've also seen strong evidence that good mental health has a positive impact on student attainment in terms of enhanced learning, creativity, ability to concentrate, and students' overall performance. And we see good evidence that it can have a positive impact on their ability when they move into the workforce. Just to look at the whole area of strengthening individuals and what the evidence base is showing us, there's been a number of systematic reviews and meta-analyses that have been carried out over the last couple of years, which have looked at the effectiveness of universal interventions which are delivered as part of curriculum and designed to improve student mental health and well-being. So when we talk about universal interventions, they generally tend to fall into three core categories. So we've got our cognitive behavioural therapy-based interventions delivered in group format, mindfulness-based interventions or relaxation interventions, and the more psychoeducational information-based interventions. In terms of the evidence base, we can see that skills-based interventions, so really the ones that are focused on the cognitive behavioural therapy, enhancing particular skill sets, they've been shown to be particularly effective in reducing symptoms of depression, anxiety, general psychological distress, and improving students' social and emotional skills. One of the things that we're seeing through the research that's particularly critical is allowing students that ability to practice these skills. So the need for that active learning on the behalf of students. Significant gaps are appearing through the evidence base, and this is particularly around scale-up and sustainability, which I'll talk about shortly. Looking at the targeted interventions which are designed specifically for at-risk students who would be at the subclinical levels in terms of depression, anxiety and distress, there is really good evidence that these interventions are effective in reducing symptoms of depression, anxiety and distress. What we do see is that there's a wide variety of interventions in terms of, again, cognitive behavioural therapy, mindfulness-based interventions, acceptance and commitment therapy, and interpersonal psychotherapy. So there's more research to do in terms of identifying some of these active ingredients in the most effective interventions. And also just to look at the kind of more technology-based interventions, the delivery of online interventions to students. What we are seeing from the research is that targeted interventions, those delivered to the most at-risk population groups, are showing, good evidence of impact. What we do see as part of this research is that the outcomes generally tend to be better when there is some type of face-to-face or online support provided. In other words, that it's not completely self-directed learning. Just to look at a practical example of work that we've been doing in the HSE around the development of curricula for higher education. So in the HEA Mental Health and Wellbeing Unit, we're working with the National Office for Suicide Prevention and the School of Veterinary Medicine on the development of a suite of universal and targeted mental health promotion and suicide prevention resources and supports that would be delivered as part of the professional growth module within the 5-year veterinary medicine degree. So for that work, over the course of last year, we've worked on the delivery, the adaptation of the evidence-based Minding Your Wellbeing programme, and we've piloted that with first-year veterinary students. So we trained up 20 facilitators, and we have one of our facilitators here today, which is great. And the facilitators delivered this intervention with first-year students in small groups of 50, approximately 15. What we did see when we NSRF conducted a process evaluation, looking at it was really looking at how feasible it was to deliver this intervention. But we did look at some areas around impact. We saw that there were significant increases in levels of self-care and attitudes around positive mental health amongst the students. The qualitative feedback from the students was overwhelmingly positive around just their engagement with the programme and their sense that really great to have this embedded in the curriculum. They did make some recommendations around the need to further adapt the programme that would specifically address the needs of first-year students, particularly around that transition from the home environment. So we're currently in the next phase of this work, and that's looking to refine the programme in consultation with the students who received the programme, but also the staff that delivered the programme. We will then look to further test this using more robust methods, and as part of that, we want to look at the delivery model if you're thinking about scaling this up at a campus level. Moving on to work in relation to strengthening communities and the potential to really develop the evidence base. We've heard this morning that it's much harder to, I suppose, evaluate the whole campus approach, but we do know that there is a need for whole university approach to promote, in particular, social connection, inclusion and belonging. We've heard quite a bit about that today. The research tells us that interpersonal difficulties such as loneliness and lack of support are one of the most common sources of distress for college students. So one of the areas that we're looking at is the potential of social prescribing in addressing these needs at a whole university level. So just to look at firstly what is social prescribing, many of you are possibly familiar with this. Social prescribing, it's a way of connecting individuals with non-clinical services and supports in the community, which are really designed to improve students, or I should say adults' mental health and wellbeing. We're currently delivering it to the adult population in the community setting. So how does it work? A service user is referred in by a health professional to the social prescribing service. They can also self-refer into social prescribing. There they will meet with a link worker, and the link worker will work with them over the course generally of about 6 weeks, firstly to understand their needs and their goals, and then to support them in engaging with community supports that are already in place in the community. So for some people, many adults, it's around connecting, looking for support in relation to connecting with others. So it's about support in joining perhaps a yoga class, a volunteering group, it could be a singing class. For others, it can be much more practical support in relation to finance, housing and education. For many people, through the HSE, it can be used as a step-down service for those who are on their recovery journey, having been and received mental health treatment. We currently deliver 46 services across the country. Over 5,500 service users accessed social prescribing last year. So I suppose just presenting social prescribing is as a potential. I think the whole higher education is an ideal setting for social prescribing because of the diverse range of services and supports that are currently in place in higher education. When you look at the range of clubs and societies, digital resources, and also the supports that are already in place in relation to finance, housing, health, there is an opportunity to really capitalise on that and bring it together through the likes of a social prescribing model. So there's a potential here to address that significant need in relation to social isolation and loneliness. And we can see from our adult service that 65% of people referred into social prescribing are for the reasons of social isolation and loneliness. So it seems to be really meeting that kind of need. One of the key things that we see is the importance of a skilled link worker. And I think, again, there's a real opportunity in terms of higher education in relation to, I suppose, being able to offer that personalised support right throughout the pathway in terms of their knowledge of supports that could be available across the campus, but also in terms of a link worker being able to normalise mental health and wellbeing issues and to support that development of resilience. Just a final slide from me in terms of research and innovation more broadly. We can see from today through the really amazing posters outside that there's an array of innovative work happening across our universities. There are some gaps in terms of our knowledge in relation to mental health and well-being in higher education, particularly around the effectiveness of interventions and supports, and secondly around scaling interventions. So how do we go from a pilot initiative to delivering it right across a campus? And I think we've more work to do in that area. And secondly, in relation to sustainability. So how do we ensure that we can embed this within the system? I do think that the National Student Mental Health and Suicide Prevention Foundation framework really provides that important foundation on which we can build and address some of these gaps, particularly through the cross-disciplinary evidence-informed approach to designing mental health and wellbeing initiatives, through that kind of co-design work that we do with students and support staff, and particularly embedding evaluation in the work that we do. Thank you.